we can monitor the nitrous oxide. And then anything in gray, they call it silent, so they don't have decisions. So mass, you cannot. Okay, so these are the stages and planes of the anesthesia. So Goodell is older, so it's from the 1920s. These are also on your pink sheet, okay? So stage 1 is analgesia, which is the nitrous oxide. Okay, so when dentists and hygienists are using nitrous, we'll stay within stage 1. Okay, so the patient is still conscious and will respond to commands. They do have a reduced sensation to pain, and the reflexes are still present when they're in stage 1. Okay. Respirations will remain regular. They will experience some memory loss sometimes. Okay, so that's stage 1. And then stage 2 is delirium or excitement. Okay, so when you're passing from the stages, you normally want to skip stage 2. So you want to go from stage 1 right to stage 3, which that is called the balanced anesthesia. So in stage 2, you have the fight or flight stimulation. So the sympathetic stimulation, which is the increased heart rate, the mydriasis, which is the pupil dilation, and the hypertension. So you have an increased heart rate. So you want to try to skip this stage completely and then go right to stage 3, which is the surgical anesthesia. And this is where most surgeries are performed. Okay, so this is where when you're having your wisdom teeth out, they're going to be in this. Okay, and then into stage 4 is the respiratory paralysis. This is if you're having longer procedures, so 5 to 6 hours, and if you're having to stop the heart or anything like that. And this is when you need artificial respiration is required with that. Just want to see if I missed anything on there. Okay, so everybody has stage 1 is the analgesia, the nitrous oxide. Stage 2 is delirium or excitement, and that's when you're going to use the ultra short acting barbiturates. Stage 3 is the surgical anesthesia. And then stage 4 is cessation of respiratory, and that's when artificial breathing is required. Did you get that?
So I'm assuming you're talking the nitrous and the ultra short are in the parentheses?
Yes.
Okay.
Yep, exactly. Okay, so then with flag, which is newer, this is what we use now to describe everything, okay? So it doesn't go into as much detail. You're going to use 3 phases. So induction, which is the preparation phase, okay? So the preoperative medications will be used in induction. And then you're gonna have the maintenance. So this is during the procedure that's going on. And then you're gonna have the recovery, which is the termination of the surgery until the patient is fully responsive again. Okay. And that's also on there. So that's the 1, 2, and 3 of the flag. So 1 is induction. 2 okay, and then 3 is recovery. Okay, so that's 1, 2, and 3, and that's all the way over to the right side.
We didn't do the top 1, 2, and 3 yet, did we?
Okay, so the first line we did the reversible and the pain control.
Right.
Okay.
Not
The
the other.
side effects are respiratory depression and loss of protection reflexes.
Oh, okay. Respiratory depression?
Yep.
And what?
Loss of protective reflexes. We didn't really go over induction yet. So induction is moving from a state of consciousness to unconsciousness. So that's called induction. Okay, so let's. Okay, so the goals of surgical anesthesia, and these are versus the adverse reactions. You want good patient control, adequate muscle relaxation, pain relief, and you want balanced anesthesia. And then the potential adverse reactions, you can have the abnormal heart rate, if they're pregnant, if they have liver damage, headache, fatigue, irritability. Addiction is also an adverse reaction. Some people can become addicted to it. Okay, so these are some of the examples, which these are all on the sheet on there, okay? So they're actually in columns. There's kind of a lot of them, so I'll have to, you wanna know the difference between each one, like how to recognize each one, okay? So like what's an opioid, benzodiazepine, propofol. I'm very bad with pronunciation, guys, I'm sorry, I try my best. Okay, so this one is used for day surgery. Over here. This is the one that Michael Jackson actually died with. He overdosed and died, okay? Used for day surgery, and that has a fast onset like the barbiturates, okay? Which is normally like 30 to 40 seconds. Ketamine this is related to, chemically related to PCP. So patients can get hallucinations, they have distorted perceptions of sounds when they use it. They can also have violent behavior with it. And the onset is a little bit slower, so it's about 1 to 2 minutes with that. And then the last one is safe for cardiovascular profiles, and that one is metabolized by the liver, okay? And that is also used in conscious sedation. Okay, I know there's a lot of writing on this slide.
I have a question.
Yes.
Which one are the inhalation anesthetics?
Okay, so that's the isoflurane and the enflurane. Okay, so. I believe those are actually on another slide too. Does everybody have these mostly written down? No, okay. Yeah, okay. Okay, so benzodiazepines, it does look like you guys covered some of these, which is good. So this is mostly part of the preoperative procedures, the pre-anesthetic. So I'm sure you guys have heard of like the Valium for anxiety and stuff. So those are benzos, peppers, and this is the inhalation, okay? So these can be given with nitrous oxide to balance the anesthesia, but not always. The methylfluorine, I don't think you can get in the US at all anymore. They are safe for asthmatics, and liver disease is contraindicated with these, and they have a slower onset and recovery, so a slower recovery. And that's where the enflurane and the isoflurane are. And those are the most popular that are used with them. Okay, so nitrous oxide in dentistry is used to reduce dental anxiety. It provides anxiety relief coupled with pain relief, which is the analgesia. Patients do remain conscious with their reflexes intact. You can use this, and most of the time I've seen this used with local anesthesia. I've seen it also used mostly in pedo offices. But it can't be a behavior modification. So if the child is acting crazy, it can't be used to tame a patient, okay? They just have to, he or she have to have like dental anxiety and just really scared of the procedure. Yeah. Okay, so the advantages, okay, so nitrous oxide is a weak general anesthetic, which I believe is on here. Yep, so this is the next thing. So it says nitrous oxide or, which is just, that was gonna be capital. N, T, O, so nitrous oxide and oxygen. Okay, so that's gonna be nitrous oxide or N2O2O2 is a weak general anesthesia because it is not very soluble in the blood. So the other one will be weak, soluble. And then the main effect of nitrous oxide is relaxation, and there's a slash sedation. And there's mild analgesia, which is pain relief. And that's the secondary effect. Did you guys get all these? Okay.
I didn't get the other IVMs, but it's 1, 2, and 3. I don't know if I missed that.
The ultra short ones? The
Under-
Accentuates?
under-
Other IV.
Under that, other IVMs is 1, 2, 3, going like.
Okay, so those are the ones that I went over, like with the Michael Jackson
Okay.
on the side. I guess I should have written them all down, sorry guys.
No, it's okay.
Mhm.
I missed the top, I'm sorry, stage 3 is what, 4 planes?
Oh, cause you're stuck a little bit late. Okay, so stage 3 is the surgical anesthesia. Yep, with the 4 flames. And then stage 4 is cessation of respiration. And that's when artificial breathing is required on the stage 4. Yeah, just surgical anesthesia, okay. Alright, so. Okay, so the advantages of nitrous oxide, the onset is quick, so 5 minutes normally. It is easy to administer. You have close control on it, and then rapid recovery, acceptable for children, and a relaxed dental team. And that's normally because the patient is relaxed, and so the dental team is a little bit more confident. Next one, we went over the good behavior management. Okay. So now the administration. See if I missed anything else on this. Local anesthesia should be also used if pain is expected during dental procedures. So that's another blank in there. And to reduce dental anxiety. So it has a rapid onset, which is 3 to 5 minutes. Okay, so when administering, the tanks are universal now because there was a mix-up of them. Okay, so the blue is always green. The blue is always green. The oxygen is always green and the nitrous is always blue. So that's really important to remember. I try to think of like the trees are green, which produce oxygen, so that's kind of a good way to think of it to try to remember. And then the other one is blue is nitrous. Okay. So now the more modern equipment has built-in safety features that don't allow more than 70% of nitrous oxide. Okay. The patient has to be monitored the whole entire time. So you're going to start with 100% oxygen. This is going to be given for 2 to 3 minutes. And then you're going to slowly increase the nitrous, so in 5 to 10 increments. And then the average use is 35% of nitrous. Okay, The respiratory, the pulse, the blood pressure, everything's going to be normal. Then after, you're gonna just do 100% oxygen for 5 minutes. Okay, so you're gonna start with 100% oxygen, and you're gonna end with 100% oxygen. Okay, so if the patient is allowed to breathe room air, diffusion hypoxia will most likely happen, which is a headache, and the treatment for that is just putting the oxygen back on, okay, for the patient. So you don't want to take the mask off or the nose cone off too quickly after the procedure. You have to really let them breathe that oxygen for 5 minutes, or they can get adverse reactions, okay, the hypoxia. Okay, this is all in the back actually. The administration. So provide 100% oxygen for 2 to 3 minutes. And then you're gonna add the nitrous and oxygen in 5 to 10% increments until the desired level is achieved, which is about 3 to 5 minutes. 35% concentration is ideal. Do not exceed 50%. At termination, treat with 100% oxygen for at least 5 minutes.
Sorry, repeat that number one again.
100% oxygen. Number one, 100% oxygen. 100% oxygen for 2 to 3 minutes.
And then add.
In 5 to 10% increments.
Yeah.
Yeah. And then 3 to 5 minutes is going to be the onset. Okay, does everybody have that? Okay. So remember, you're gonna start with 100% oxygen and you're gonna end with 100% oxygen. Okay, so diffusion hypoxia is if you're gonna remove the oxygen too soon, they're gonna get a headache. So the first symptom is gonna be body warmth, you're gonna have tingling of the hands and feet. Actually, in your book, on page 115, there is a table that it does describe all the different signs and symptoms at the different percentage level, so it does a really good job of that. I think it does say the first symptom on your worksheet, so you're gonna put tingling of the hands. A good indicator that the nitrous is working is if you're asking the patient's questions and if they're slurring their speech. So you can be talking to them while you're giving them the nitrous, and once they start having slower answers and slurred speech, you can tell that it's working, okay? Okay, so these are some of the adverse reactions. So mistaking the nitrous oxide for oxygen. So we wanna just remember that the nitrous is blue, the oxygen is green. Peripheral vasodilation, which is when the widening of the blood vessels, so the patient is going to get more blood flow and it's gonna give them like flushed skin. You can have misuse of the nitrous oxide. You'll get paraesthesia, which is pins and needle feeling, and then neuropathy, which is damage to the nerves. And if you are having misuse of it, you can have the B12 deficiency can occur. I don't think that's on there. So the most common side effect is the diffusion hypoxia, which is on there. And the first symptom, tingling of the hands and feet, of the hands.
patient will get a headache.
Exactly, yep. Okay, so the contraindications, if a patient comes in and they have a head cold or respiratory obstruction, that might be a reason if they're going to use nitrous oxide to reappoint them if they have a really bad head cold, because they have to use their upper respiratory to inhale the nitrous. So you might want to reappoint with the respiratory. If they have cystic fibrosis, which is the body is producing like a thick mucus, that's going to be a contraindication. Any chronic like COPD, which is emphysema, or bronchitis, that's also a contraindication, because if they have difficulty with emphysema and bronchitis, they have difficulty if they are receiving more oxygen than they normally are breathing. If they're pregnant, it is a risk C. So I know that you guys talked about not using the risks anymore, but if the drug is from before 2015, then the FDA still does use these risks. So they can have incidents of spontaneous miscarriages. And this is more the female operators in the dental, because we don't have as good ventilation in the dental operatories as you would in a hospital. So if you're exposed to more than 5 hours a week, it was shown that you are significantly less fertile. Okay, so it is a big deal for women operators in the dental. So you do want to be checking the concentrations in the dental operatories. Okay. Okay, so if you have a patient that is emotionally unstable, they're taking psychotherapeutic meds, you have to be careful with those patients. Okay, you always want to have somebody in the room with you if you're using nitrous, so that you always have a witness, because you don't want the patient to come back saying he did this and she did that. Okay, so you always want to have somebody with you in there.
I see patients, instead of getting calm, they get hyper.
Yeah,
With
see,
the nitrous.
if you when you're using the nitrous, you can get like a euphoria feeling, so a state of happiness or excitement. So they just say to evaluate people that are taking psychotherapeutic meds before you're using the nitrous. And then a language barrier, you want to make sure that the patient is understanding everything that's going to happen when using nitrous oxide. Okay. You also want to know if they have any allergies. So if they're speaking a different language, you really have to have an interpreter there with you. And then contagious diseases. So it had hepatitis, which there is a cure for. But we still put it on there, and then TB. Okay, and there's some disadvantages that we kind of already went over. Okay, and so they do say that you want to avoid heavy meals within 3 hours of the appointment, which I believe is that on there. Okay, so that's back to the front. It says the patient should eat lightly approximately 2 hours before receiving nitrous oxide. Normally, we had morning appointments for these patients that were getting the nitrous, or if they're children, right after school, so that they can come get the procedure done and then they can have their snack or their meal. Okay, but no large meals at least 3 hours before using the nitrous. Okay, and then they can have a light snack, but I normally just say no eating or drinking. Okay, so these are just some other notes. So it's just the most common inhaled anesthetic. Nitrous oxide are the blue tanks, oxygen are the green tanks. What else do I have? No biotransformation takes place in the body. Exhalation is the major route of excretion. And then I have one more slide about balance anesthesia, which we kind of talked about in the beginning. So just the goals of surgical anesthesia are good patient control, adequate muscle relaxation, and pain relief. And just remember that balance anesthesia, you want to pass from stage 1 to stage 3, okay? So you want to avoid stage 2. And that's the balanced anesthesia. So you want to have a rapid induction, is what they say, which is passing from a state of consciousness to unconsciousness. Okay? I do have a, does everybody have the sheet filled out? Okay,
I don't.
okay. Alright, what part are we missing?
Alright, it has a rapid action will set 3 to 5 minutes and a,
Okay, at the bottom. And a rapid recovery.
and then, so blue and green, the patient eats lightly,
Yep,
2 hours.
2 hours.
Simply hands, administer blah 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 for upper headache.
Administer oxygen, okay, for 3 to 5 minutes.
And then the best indicator is the
Oh,
patient's
answer
ability
questions, yeah.
to answer
Did you
questions.
just put
Yep.
the top three? I put all of them too.
The patient's ability to answer questions.
Those three.
And then contraindications, 1, 2.
Oh, yeah,
Because I had so many, I don't know which
I know.
one.
Okay, so number 1 is going to be respiratory/contagious diseases for the contraindications on the bottom. Number 2 is going to be emotional instability. Number 3 is going to be pregnancy.
Oh,
Is anybody else missing any? No, okay. I just have a quick quiz for you guys. It's actually online. Does everybody have like a phone or something that they can use? It's only 7 questions, so it's actually really quick, I promise. I know that you're already past the time.
Like that, that's what I've written it
I'm
in.
not wearing my glasses.
The actual years.
Okay, so you have to go to Kahoot. Have you guys used Kahoot before?
Yeah.
Oh, okay, I had never heard of it before, so that's good. It's very, the quiz is very quick. I'm not wearing my glasses. Okay, so everybody have their phone out or some electronic device, I guess. And this is the pin that you're gonna put it. So Kahoot it, and this is the pin. And you don't have to put your real names if you guys don't want to. I thought it was like fun if you had like made up names. That's what I was practicing at home. So whatever you want. Ooh, this helped me. What is he doing? I know.
Oh. Sorry to think, what can I
That's
do?
okay. Oh, the lion is cute. Oh, those are good ones. Okay. I wouldn't have thought of that. There's none. The 2, that's also a really good one. Good idea. Okay, 2 more people, right?
Yeah, it's not letting me log in. I don't know.
682.
I don't know. It's telling me that I can't log in.
Okay, you can just play along if you want to.
Yeah.
Is there your internet maybe?
No,
I know the internet is kind of slow. That's
I have
fine.
an invalid username.
You don't have to log in, you just go to Kahoot.
Oh, yeah, .it.
I don't know. .it. I just have the app on there. It worked last time.
Oh, yeah.
Either way, just go.
Okay. Alright, that's it. Okay. I think there's like 20 seconds for each one. So what is induction? And then there's 4. So 20 seconds for this one.
Yeah, for sure.
I just know
Did you
which is method, like,
No, it is.
yeah, they actually used to like bang somebody on the head or use like strangulation before. Yeah, that's why I put that in there. Okay. Good job, guys.
Who chose that?
Alright, so next one.
Oh, I got it in there.
Oh my god, it's a
I just
different
froze
color
out
than
by
the
putting
word.
it with the opposite color.
And I actually didn't mean to do that, but then after I realized it, I was like, okay, it makes it more of a challenge.
Yeah.
Alright, so it is blue. Yes, false. Okay, good. Alright. Okay, there's actually two correct answers here. So you can pick either one. Okay, yeah. I'm assuming whoever picked increased dental anxiety. Yeah, okay. That was accidental. Alright.
It's really bad.
Okay, so nitrous oxide is the most commonly inhaled anesthesia. So that was true. Okay, almost done. So what color is the oxygen tank? Just make sure you read them, not go by the color. Okay, it's green. And we have one more. Whoever's the pumpkin is getting them all right. So what is hypoxia? Okay, so lack of oxygen is what it is, yeah. The two of you just hit too much oxygen. So lack of oxygen is a hypoxia, and you'll know if the patient is complaining of a headache, and you treat with 100% oxygen again, okay? So they might have just taken the nose cone off too soon. Okay, and that's it for that. Good job, guys. Alright, I think that was a little different than the paper one. Good job. Okay, so I just need the evaluations handed back, and I don't think you need to put your name on them at all. Okay, so if you guys can just fill those out and then pass them back to me before you
What is the
leave.
date today? 20?